Well, good evening. I probably am going to stray a little bit from what Kelly just said because I've been involved with the health transformation stuff since it was a legislative concept and am now on the board as mentioned. And the thing that strikes me, and you've heard it talked about already a lot, is health transformation is really about connecting the dots with the members, connecting the dots with the providers, and Linn County is a major provider for the whole thing as far as connecting mental health, physical health, dental health, you name it. Another piece that's connected in the CCO is transportation. Which doesn't get talked about a lot, but one of the problems that is being solved is if you can't get to see your provider, it doesn't exist, literally. So that's been tied into it. There's just, you've heard the comments about the community relationships, the community input from the members. So the thing that's really interesting to me from sitting on the board is just watching all the things that have evolved over time, and truthfully it's still evolving because it's not done yet by any means. And that's one of the neat things about sitting on the board is you get to hear that, you get the inputs about what's happening medically. So it's just, from my perspective, it's really neat. I've got to say this, when you look back, and again, this whole thing started 2010, 2011, and when something happens and you literally see, okay, the whole idea, and it's encompassed in the name, is coordination. And it's all focused on the member. And it's all focused on making sure, and was just mentioned with the prescriptions, the dentist knows, the doctor knows, the mental health provider knows, everybody knows what that prescription for that member, and so you get to not overlap and do the things that, and it's not done yet. There's still a lot of work to do, but from my perspective, it's really neat that the county health department is involved with this. The county health department is changing and evolving and getting better. And quite frankly, we now have competition, for example, in mental health. If there's another provider there, they may do a better job than we do, so we have to do a better job than they do, literally. So that goes on. Anyway, from my perspective, it's really neat, and it's going to be even better 5 years down the road. Thank you.